They say into each life, some rain must fall. But if you or someone you care about is experiencing significant emotional problems, ranging from prolonged sadness or anger to fear or confusion, turn to Crossbridge Behavioral Health. Crossbridge, a Baptist health facility, offers innovative inpatient and outpatient treatment for adults and geriatrics in a modern, caring environment. Crossbridge and Baptist Health. Healthy mind, healthy body.
It's JT. We're here at Baptist South in Montgomery. We're talking with Dr. Suggs. Dr. Suggs, thanks for joining us.
Glad to be here.
And we've talked before about how Thomson Reuters has recently ranked Baptist South one of the top 15 health systems across the nation, which is great. And let's talk about the Stroke Center here at Baptist South. Tell our viewers what you guys have to offer when it comes to treatment.
Well, we've been working for the past year to develop our Stroke Center. And basically, when folks have a stroke, they need to be checked quickly. And everything has been gauged here to allow for a quick assessment for the stroke patient. In other words, there are certain things that have to happen before we can assess and make the decision to give our medicine for TPA. And there's a certification process that has been gone through by Baptist South to ensure that that happens. The Joint Commission is an organization that certifies hospitals, first of all, generally. So if you're certified or accredited, then the Joint Commission has done that. But they also have a disease-specific program for stroke. And they've come in now and did a one-day assessment of our ability to care for stroke. So if you come in the emergency room here, everything is geared toward a quick outcome, trying to get the CT scan as quickly as possible, which gives us information we need to make that decision for TPA. And it's a rigorous process, and there's a lot of different parts of the hospital that are involved. We had administrative personnel involved, we had laboratory, we had nursing, we had ER physicians, we had hospitalists, and laboratory and pharmacy, and just a whole host of different areas that are involved in this. And this is actually the first certified stroke center in the central part of Alabama. And there's only, I think, maybe 5 or 6 in the entire state that are certified. So we're real proud of that accomplishment.
What about stroke risk factors and prevention? JT spoke with Sharon Ewer, a stroke coordinator with Baptist. This information could truly be life-saving.
So when we're talking to our community about stroke prevention, we always assess whether it's a modifiable versus a non-modifiable risk factor. So things that they cannot change that put them at risk of having a stroke: their age. Anybody 55 years or older is at a high risk of having a stroke. Family history of stroke puts them at a risk of having a stroke. Their age, race, gender, a previous stroke or a previous MI also puts them at a high risk of having a stroke. So what we really want to focus on are things that we can change or modify, such as high blood pressure. If they have a history of high blood pressure, we want to make sure that they're taking their medications. We look at their social history. Are they a cigarette smoker? Do they abuse drugs? Do they abuse alcohol? All of those put them at risk of having a stroke as well. Other things that we look at, their cholesterol. Do they have a history of high cholesterol? Are they increased body weight, physical activity? Their eating habits, poor eating habits as well, all contribute to those risk factors. Then we look at things such as sickle cell patients are at high risk. People with obstructive sleep apnea are also at high risk of stroke. When we look at their risk factors, we also look at, teaching them prevention and signs and symptoms to recognize if they're having a stroke or not. So we tell them to look at their face. Is their face uneven when they smile? Is their arm weak? Do they have numbness or tingling on one side of their body? And it's a sudden onset. So if they have a history of diabetes or something that puts them at risk of having neuropathy, that symptom that they'll have where they have tingling or weakness in one arm, we always tell them, this is different. This is a sudden onset. Headache, blurred vision, difficulty with their speech, understanding what they're saying or having difficulty understanding what someone else is saying to them. If they're having any of these symptoms, we always tell them just pick up the phone and call 911 immediately.
Thanks, Sharon, for sharing that great information. Learn more about stroke prevention and analyze your own risk factors by visiting the Primary Stroke Center under the Specialties and Services tab at
We're speaking with Russell Tyner, who's the CEO of Baptist Health, and recently Thomson Reuters ranked Baptist Health one of the top 15 health systems in the country and the only one in the state of Alabama that was recognized. First of all, congratulations. That's awesome.
Thank you, JT.
Tell me a little bit about the plans and procedures that Baptist Health put into place several years ago to make that possible.
Well, what you see here, the Simulation Center, is one of those things. 4 or 5 years ago, we began dabbling in the simulation arena. It's something that we learned from our friends in the aviation industry, particularly those in the Air Force in and around Montgomery. The simulation picked up very quickly in healthcare, and we were sort of on the cutting edge of that out front. But we learned very quickly also that simulation in and of itself was useful, but you had to put that curriculum